So I'll talk about AIDS. AIDS or Immunodeficiency Syndrome. Acquired Immunodeficiency Syndrome. Acha, do you know about basic immunity? How it is controlled? Huh? Anybody? बोल बोल कोनो भाई we are all students. No embarrassment. बोल. Acquired and cellular and humoral. Acha, humoral. Cellular immunity is dependent on T cell and T cell. Mainly T cell. Cellular immunity on T cell. How many types of T cells are there? T helper cell? 3 types. Correct. 3 types. Kya che? T cells 3 types. Kya che? What are those? Helper, cytotoxic, then T8 is suppressor cell or cytotoxic cell. There is another cell called Treg. Treg. That means T regulatory cells. T cell regulatory. Maybe, but these things are important for when you appear for MD examination. So you have to know little tidbits. T-reg cells. What about humoral immunity? Mature B cells. B cells converting to plasma cells. And they produce antibodies. So these are the basic things. Ultimately, T4 cell, that means T helper cell, they are the ultimate potent cell. They stimulate interleukins, they stimulate macrophages, they stimulate B cells. So T helper cells are primary responsible for immunity. And we may have congenital immunodeficiency from birth. We may have acquired. The congenital, have you heard of Bruton's glomaglobulinemia? And I'll come, and DiGeorge Syndrome, DiGeorge Syndrome, Bruton's, and there are so many. Combined immunodeficiency, there are so many. Acquired are by different viral infections. They make the T cells loose from our body, destroy the T4 cells, and they destroy the macrophages. So one of these immunodeficiency virus is this, what is this called? HIV virus, human immunodeficiency virus. So this is very important, and this is mostly common was in sub-Saharan Africa. It came from Africa. So mainly it was common in homosexuals, drug abusers, etc., etc. India faced the challenge of this immunodeficiency virus late, very late. It is an imported disease. So as we have mentioned, we have 2 types of immunodeficiency. Primary, in medical science, primary means de novo, which is original. And secondary means secondary to something else. some other diseases. This is the basic. So secondary immunodeficiency, cancer, diabetes, malnutrition, and chronic infection. So these are basically criteria of AIDS. AIDS should be it should be caused by HIV virus. There will be severe immunosuppression. There should be opportunistic infection, secondary neoplasm, CNS manifestation. See how funny it is. AIDS often presented as opportunistic infection, different protozoal fungal infection. Then you come to know, oh, okay, this patient is suffering from AIDS. And immunodeficiency, they cause immunodeficiency, they cause T-helper cell loss, but it causes secondary different types of cancer. This is also very funny. Ah, any immunodeficiency causing virus, they are causing cancers also. Apparently unexplainable. You already know who are the population or who are the persons suffer from who suffer from this AIDS. They are homosexuals, drug abusers, hemophiliacs, uncommon. Also heterosexual. And one of the very important thing is a mother suffering from AIDS will transmit the virus through placenta to the newborn baby or fetus. So this is important for your postgraduate MCQ. The AIDS can pass through from mother to fetus. তাহলে mode of infection is very important. আমরা যখন ওয়ার্ডে যাই, when we go to hospitals, there are severe cut marks. Often when giving injection or when doing any procedure, there will be cut marks. So any cut marks, most important thing is when you will handle patients, if there is a cut marks, there is a chance of hepatitis B virus. You should immediately take action if you have a cut or nick or prick by any needle, etc. Here also, if you have, if you draw blood from an AIDS patient and there is a cut marks, you can have AIDS. So direct inoculation, infection of the T4 cell, CD4 cells. Predisposing condition, this you know. If any person suffer from, have these types of diseases, they are predisposed to AIDS. This, have you covered AIDS in microbiology? This you will learn in details in microbiology. The basic thing is that the AIDS virus is a spherical virus. It has got a, what book you have? What book you have? Hirschman. There is a beautiful photograph in Hirschman. AIDS virus ka, dekho. There's a photograph. So you practice this photograph. This will be important in pathology and microbiology also. So it has got it's a spherical one. The inside vivarium is what it is called? It's a cone shaped. And as you know, the membrane is protein, it's formed of protein and lipids. AIDS have got 2 RNA at the core. Eta mone rakhbi, AIDS is a RNA virus. RNA virus, it has got RNA to the core. The capsule is called capsid, and there are different antigens over the capsid. As for example, you'll read it, you draw the diagram in your copy and remember by heart, but I'm just giving an overview. The GP, जैसे GP 120, GP means glycoprotein, glycoprotein. GP 120 and GP 41. This is probably, these two glycoprotein are responsible for its replication. And what is that called? GP24 probably. দেখ তো কি আছে? GP24 বলে কিছু আছে। 40 না 41 তো এখানে আছে, দেখ এটা 24 আছে বোধহয়। GP24 is important for infectivity. You remember this. 24 is responsible for infectivity, and 120 and 41 are responsible for replication. So these two things are important for MCQ. Remember this. Another important thing is the reverse transcriptase enzyme. This enzyme helps to form DNA from RNA. So that will help in replication. So this is important. This is important for replication, and GP24 is important for infectivity. এটা তোরা পরে পড়ে নিবি. It's a slightly difficult one. Just you have to remember it. What are the genome? GAG, GAG, POL, ENV, ENV. তাহলে আমাদের দেখতে হবে যে HIV ভাইরাস, what it targets, কি এটা টার্গেট করছে. The cellular level, they target lymphocyte, macrophages, dendritic cell. Dendritic cell মানে কি? Antigen presenting cell. They can also be called macrophages of the CNS. They are basically macrophages of central nervous system. So they target lymphocytes and along with different macrophages, which has the power of engulfing, which has the power of presenting an antigen. At the systemic level, they target the immune system and CNS. Immune system and CNS. Pathogenesis in two lines. Two lines pathogenesis. Cell-mediated immunodeficiency. Immunoglobulin level ও কমবে, কিন্তু সেটা পরে. Primary cell-mediated immunodeficiency. And loss of, basically, its virus destroys CD4 T-cell. That means helper cell. And causes destruction of immune system. Tropism কথাটার মানে কি? What's the meaning of tropism? Affinity. Likes. I like him. That means I have a tropism for him. So virus has the tropism for CD4 cell, macrophages, microglial cell. Microglia কোথায় থাকে? Where it is situated? In the brain. Brain, there are two types of structure. One is neurons, other is basic supporting structure. Microglia is one of the supporting structure of the brain. This is not neuron. Neuron and microglia makes the central nervous system. Understood? So, HIV virus has the likeness for this type of cells. They love this type of cells. So, if you love someone, you will be closer to that. You will infect those cells and destroy those cells. This is tropism. Acha, this you just see and you can read it later. I'm just skipping this. I'm not going into the details of life cycle. It is there. It is in every textbook. In short, in nutshell, the life cycle is infection of a cell, integration of the provirus. Provirus means the virus which is not very active. Provirus into the host cell genome. The virus enters the host cell genome. Activation of the viral replication, production and release of viral particle. So basically virus, what they do? Their RNA first converts into DNA. That DNA will attach to DNA of the host cell. Say me, my DNA, my cellular DNA, they attach and they then direct the human cells to produce more virions or virus particle. So they did it in a very high level through nuclear protein level. They direct them to produce viral DNA. Whom they direct? They direct human cells. They direct the cells which they are infecting to produce nuclear material so that there is replication. So integration of the provirus into host cell genome, activation of replication, then release of virus particle. Achha, the total life cycle is there. This is the virus attached to CD4. This virus, the nuclear material, that means I told you that this is a RNA, it is released. That RNA got inside by means of red is RNA. When it converted to DNA, it is greenish by reverse transcriptase. This DNA is attached to the human cell, the host cell. They make a big DNA. From this big DNA, they produce RNA, and from those RNA, there is replication. So basically, viral RNA first turns into DNA, then combines with human DNA. So mainly there is T-cell loss. I have already told you. A big diagram, just see at the bottom, mainly they are lost by cytopathic effect of the virus. By cytopathic effect of the virus, our T-cell, we lose our T-cell. And also by apoptosis. If any cell is viral infected, the cell will undergo apoptosis. So these are the two main methods. T cell means macrophages and dendritic cell. Dendritic cell, they are also macrophages. They present antigens and macrophages. They have got the power of, uh, what is that called? Killing others, engulfing others. They present antigens. B cells also, there are changes. What are the changes? If B cells are infected or they are stimulated, there is plasmacytosis. There will be hypergamma globulinemia. There will be immune complexes. Next. So I am skipping this. Next. Primary infection, the viral dissemination, and acute retroviral syndrome. ARS, acute retroviral syndrome. First, there is depletion of the memory T cell, then there is viral dissemination, host immunity development, then acute retroviral syndrome. Seroconversion. Suppose someone is exposed to viral infection. This seroconversion will happen in 3 to 7 weeks. After that, the viral serology will be positive. Viral titer begins to fall and CD4 activity begins. CD4 is cytotoxic, they destroy cells. Control of viremia to low but detectable level 12 weeks post-exposure. Even after 12 weeks post-exposure, যখন থেকে you are infected, তখনও you can detect virus. Next. তাহলে acute retroviral syndrome, সেটা কি? What are those? There will be sore throat, very non-specific symptoms. You may miss it. Any doctor can miss it. Sore throat, myalgia, fever, weight loss, fatigue. So to say, there is flu-like syndrome. You may detect this patient acutely when they are just exposed, few weeks after exposure. Most of the AIDS patients, they go into chronic phase, very chronic phase. They can live even years after years without being detected. That is the problem with AIDS. There is very scarce signs and symptoms. You may fail to diagnose AIDS unless you are very alert. So, what are these chronic phase or phase of latency? What are these? Remember, lymph node, spleen, they are very common sites for replication. The median time for untreated patient is 10 years. It won't be required for you. The rate of disease progression is directly correlated with HIV RNA level. So remember, many of the AIDS patients, they go into chronic phase. There may be long-term non-progressor. There will be elite non-progressor. So the chronic phase exists in AIDS. See the difference. What are long-term non-progressor and elite non-progressor? They will present to you after 10 years, after 20 years. এমনও হতে পারে যে CD4 count is very stable. You won't be able to identify AIDS. Next. So, ultimately, who is the patient of AIDS? কাকে আমরা বলবো the patient is suffering from AIDS? কাকে বলবো? অনেক সময় আমাদের will suspect many patients, but all are not AIDS. There may be some other immunodeficiency virus. তো কাকে বলবো? HIV infection present and CD4 count is very important. Like in every hospital, there is a machine by which you can count, especially it is in AIDS control department or in microbiology, they count CD4 T-cell. So, not only the symptomatology of AIDS, but the count of CD4 is very important. It is less than 200 per microliter. So what's the normal count for CD4? You have to know then. What's the normal count? দেখে বল, ওটা শিখে নিবি, দেখে নিবি, হ্যাঁ? What is the normal count of CD4? Unless you know the normal, how can you know, remember the abnormal? This is one or HIV infection present and patient develops one of the HIV associated disease considered to be indicative of severe defect in cell mediated immunity. এটা থাকতে পারে, or patient may have different features which will tell you that patient is suffering from severe immunodeficiency. Next, AIDS is often recognized by opportunistic infection. What is opportunistic infection? Bolo? Opportunistic infection মানে কি? What is that? Or you are staying in a house and one of your door is slightly open and burglar burst in. A burglar or a thief enters. That is opportunistic. Any disease which exploits you on the background of severe immunodeficiency. So AIDS say এরকম আর কোনো disease নেই. There are so many, a long list of opportunistic infection. Probably this is the single most glaring example. Opportunistic infection is. Different types of infection. Protozoal, fungal, bacterial, virus, and those protozoal and fungal infections are varied. Hundreds of infection. এরকম disease are very rare. What is this? What I wanted to show you? AIDS, when you see the patient of AIDS, you will see that severe sarcopenia or severe weight loss. If any patient presents to you with severe weight loss, there is a criteria for that. In this amount of weight loss in this period of time. So, apart from many diseases, you have to consider AIDS. What is this? These are fungal infection of the buccal mucosa. This is very common. Have you seen any newborn? Very common in newborns. Oral thrush, we call it oral thrush. But this is, if you suffer from unexplained fungal infection, always think of, it may be first diabetes, high sugar level. If you suffer from very severe fungal infection, it may be due to diabetes or it may be due to AIDS. What is this? There are small blisters in the mucous membrane. Probably these are herpes infection. Herpes labialis. Very common. We also suffer from herpes. One is herpes labialis, one is herpes zoster. What occurs, what happens after chicken pox? আমাদের হয়তো দেখেছিস herpes zoster, you suffered very severe pain along the nerve roots, nerve distribution. That is herpes zoster. This is herpes, a different type of herpes. Molluscum. Molluscum contagiosum. This is a very big tumor here. This is a very big tumor here. সবসময় মনে রাখবি, you have to remember that AIDS give rise to different types of malignancy. আমাদের malignancy কটা আছে? One is cancer. Cancer কোনটাকে বলে? Cancer এর definition কি? What is the definition of cancer? Dysregulated growth of epithelial cell. Cancer. What is the definition of carcinoma? What is the definition of sarcoma? Mesenchymal cell. The mesenchymal cell meaning ki? What do you mean by mesenchymal cells? Muscle, bone, fat, supporting structure. Mesenchymal cell means supporting structure. Microglia. So there is carcinoma, there is sarcoma, there is lymphoma. What do you mean by lymphoma? Malignancy, malignant transformation of lymph node. এরকম বড় বড় lymph node থাকবে all over the body, in the cervical region and the axillary region. So AIDS causes immunodeficiency, and AIDS is notorious for causing Kaposi sarcoma. It is one form of sarcoma of the blood vessels. Blood vessel malignancy. So it is very common in AIDS, and there is non-Hodgkin lymphoma. In lymphoma there are two types, Hodgkin, non-Hodgkin. AIDS causes mainly non-Hodgkin lymphoma. And there are so many things. I'm just telling the important one. There are so many malignancies. Anything else? We have a very long list of protozoal, fungal diseases. You remember this. These are very important for MD MCQ examination. Give a star mark. Give a star on your notebook. Cryptococcosis, toxoplasma, these are protozoal disease. Next is Next is fungal infection, pneumocystis carinii, candidiasis, histoplasmosis. I am just reading out the important one. Next is bacterial infection, atypical mycobacteria, যেটাকে আমরা বলি টিবি. টিবি যখন টিপিক্যাল হবে, it is very easy to diagnose. When it is atypical, slightly different, it is difficult to diagnose, difficult to treat also. So atypical mycobacteria. Viral infection, cytomegalovirus. I have given you beautiful picture of herpes simplex and varicella zoster, which is otherwise called chickenpox. So AIDS is characterized by these so many long list of disease which you may miss. তোমার কাছে চিকেন পক্স পেশেন্ট এলো কি হারপিস জোস্টার পেশেন্ট এলো, you'll treat that patient. Simple antivirus, there are so many antiviral drugs, but you may forget to treat, or you may think, you may forget to think that there is a background AIDS infection. Huh? Understood? Next. I've already told you, Kaposi sarcoma. Very big name. It's nothing but sarcoma means malignancy of blood vessels. Kaposi sarcoma, very important for MCQ. Lymphoma. Jodi kokhono have you in your life, if you see any lymphoma affecting your brain, jodi if you have seen, diagnose it as the patient of AIDS. Brain lymphoma is only occurs in AIDS, no other disease. There are ordinary different types of cervical carcinoma, anal carcinoma, but Kaposi sarcoma and CNS lymphoma is very, very important. Next. Primary immunodeficiency. Basically, there's a long list: X-linked, A-gamma globulinemia bruton, found in very small babies. Patient cannot produce antibodies. Combined variable immunodeficiency, isolated IgA deficiency, etc., etc. So these most of these patients, they present in very early childhood. And this is very difficult to diagnose also. They present with recurrent infection, recurrent protracted infection. Bar you are giving antibiotic, patient is not healing. Patient is not healed up. So this is a separate chapter. It may be it's written present in infancy, recurrent infection. Next. I'll tell you DiGeorge Syndrome. Remember, read it very carefully. This is important for your MD MCQ. DiGeorge Syndrome. So make a note. And Wiskott-Aldrich syndrome. These two are very important. So, lastly, what we are discussing now, that first to discuss AIDS, this is secondary. Now there are few cases which are primary, which are in our body from since when we are born. So this is list of primary one. Secondary one, AIDS is important for your practical life. Primary one is important for your MCQ. Next. So these are the books. What books you are reading? So we have so many things. The total medical knowledge is in at least you have to read 10, 15 books. So very important, very difficult to remember. Our brain capacity is limited. So you have to be very intelligent, very careful to picking up the important one, which are common, which is the core knowledge. Core knowledge is important. Knowledge you must know. You don't know anything. The core knowledge is important. After that, the important things are you have to set for different examination for MD or higher studies. That knowledge is very also important. So core knowledge is important for treating patient, for passing examination, and for becoming a basic doctor. And the next level of knowledge, nice to know, good to know, the next knowledge is important for your higher studies, for your research, etc., etc. So, as our capacity of brain is limited, there are so many things to read. We have to be very choosy. What is the core knowledge and what is the next level of knowledge? Okay, thank you.